Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. When teaching a female patient how to take a sublingual tablet, the nurse should instruct the patient to place the table on the Option A. Top of the tongue. Option B. Roof of the mouth. Option C. Floor of the mouth. Option D. Inside of the cheek. Right answer is Option C. Floor of the mouth. The nurse should instruct the patient to touch the tip of the tongue to the roof of the mouth and then place the sublingual tablet on the floor of the mouth. Sublingual medications are absorbed directly into the bloodstream from the oral mucosa, bypassing the GI and hepatic systems. No drug is administered on top of the tongue or on the roof of the mouth. With the buccal root, the tablet is placed between the gum and the cheek. Which action by the nurse in charge is essential when cleaning the area around a Jackson-Pratt wound drain? Option A. Cleaning from the center outward in a circular motion. Option B. Removing the drain before cleaning the skin. Option C. Cleaning briskly around the site with alcohol. Option D. Wearing sterile gloves and a mask. Right answer is Option A. Cleaning from the center outward in a circular motion. The nurse always should clean around a wound drain, moving from center outward in ever larger circles, because the skin near the drain site is more contaminated than the site itself. The nurse should never remove the drain before cleaning the skin. Alcohol should never be used to clean around a drain. It may irritate the skin and has no lasting effect on bacteria because it evaporates. The nurse should wear sterile gloves to prevent contamination, but a mask is not necessary. The doctor orders dextrose 5% in water, 1000 milliliters to be infused over 8 hours. The IV tubing delivers 15 drops per milliliter. The nurse in charge should run the IV infusion at a rate of Option A. 15 drop per minute. Option B. 21 drop per minute. Option C. 32 drop per minute. Option D. 125 drops per minute. Right answer is Option C. 32 drop per minute. Giving 1000 milliliters over 8 hours is the same as giving 125 milliliters over 1 hour, 60 minutes. To find the number of milliliters per minute, 125 sixtieths of a minute equals x/1 minute 60 x equals 125 x equals 2.1 milliliters/minute. To find the number of drops/minute, 2.1 milliliters/x GTTS equals 1 milliliter/15 GTTS x equals 32 GTTS/minute, or 32 drops/minute. A female patient undergoes a total abdominal hysterectomy. When assessing the patient 10 hours later, the nurse identifies which finding as an early sign of shock. Option A. Restlessness. Option B. Pale, warm, dry skin. Option C. Heart rate of 110 beats/minute. Option D. Urine output of 30 milliliters/hour. Right answer is Option A. Restlessness. Early in shock, hyperactivity of the sympathetic nervous system causes increased epinephrine secretion, which typically makes the patient restless, anxious, nervous, and irritable. It also decreases tissue perfusion to the skin, causing pale, cool, clammy skin. An above normal heart rate is a late sign of shock. A urine output of 30 milliliters/hour is within normal limits. Which pulse should the nurse palpate during rapid assessment of an unconscious male adult? Option A. Radial. Option B. Brachial. Option C. Femoral. Option D. Carotid. Right answer is Option D. Carotid. During a rapid assessment, the nurse's first priority is to check the patient's vital functions by assessing his airway, breathing, and circulation. To check a patient's circulation, The nurse must assess his heart and vascular network function. This is done by checking his skin color, temperature, mental status and, most importantly, his pulse. The nurse should use the carotid artery to check a patient's circulation. Which intervention is an example of primary prevention? Option A. Administering digoxin, Lasix caps, to a patient with heart failure. Option B. Administering a measles, mumps, and rubella immunization to an infant. Option C. Obtaining a Papa Nicolau smear to screen for cervical cancer. Option D. Obtaining a Papa Nicolau smear to screen for cervical cancer. Right answer is Option B. Administering a measles, mumps, and rubella immunization to an infant. Immunizing an infant is an example of primary prevention, which aims to prevent health problems. Administering digoxin to treat heart failure and obtaining a smear for a screening test are examples for secondary prevention, which promotes early detection and treatment of disease. Using occupational therapy to help a patient cope with arthritis is an example of tertiary prevention, which aims to help a patient deal with the residual consequences of a problem or to prevent the problem from recurring. The nurse in charge is assessing a patient's abdomen. Which examination technique should the nurse use first? Option A. Auscultation. Option B. Inspection. Option C. Percussion. Option D. Palpation. Right answer is Option B. Inspection. Inspection always comes first when performing a physical examination. Percussion and palpation of the abdomen may affect bowel motility and therefore should follow auscultation. Which statement regarding heart sounds is correct? Option A. S1 and S2 sound equally loud over the entire cardiac area. Option B. S1 and S2 sound fainter at the apex. Option C. S1 and S2 sound fainter at the base. Option D. S1 is loudest at the apex, and S2 is loudest at the base. Right answer is Option D. S1 is loudest at the apex, and S2 is loudest at the base. The S1 sound, the loop sound, is loudest at the apex of the heart. It sounds longer, lower, and louder there than the S2 sounds. The S2, the dub sound, is loudest at the base. It sounds shorter, sharper, higher, and louder there than S1. The nurse in charge identifies a patient's responses to actual or potential health problems during which step of the nursing process? Option A. Assessment. Option B. Nursing diagnosis. Option C. Planning. Option D. Evaluation. Right answer is Option B. Nursing diagnosis. The nurse identifies human responses to actual or potential health problems during the nursing diagnosis step of the nursing process. During the assessment step, the nurse systematically collects data about the patient or family. During the planning step, the nurse develops strategies to resolve or decrease the patient's problem. During the evaluation step, the nurse determines the effectiveness of the plan of care. A female patient is receiving furosemide, Lasix, 40 mg POBID in the plan of care. The nurse should emphasize teaching the patient about the importance of consuming. Option A. Fresh, green vegetables. Option B. Bananas and oranges. Option C. Lean red meat. Option D. Creamed corn. Right answer is Option B. Bananas and oranges. Because furosemide is a potassium-wasting diuretic, the nurse should plan to teach the patient to increase intake of potassium-rich foods, such as bananas and oranges. Fresh, green vegetables, lean red meat, and creamed corn are not good sources of potassium. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share, subscribe our channel for regular updates.